So here I am just showing you how to prepare PRP in my center. ACD solution I used, and take a collection of the blood, and this is my PRP centrifuge, and I used PRP kits. Double centrifuge method is there, and after double centrifuge making of the PRP, and I inject the PRP in various types of pathology, and this. So my second talk is on BMAC, bone marrow aspirate concentrate. So what are the components of the BMAC? Bone marrow is mainly two components, cellular and protein. The bone marrow includes platelet, erythrocyte, leukocytes, plasma containing cytokines and other proteins. So within the heterogeneous leukocyte populations, there are two main types of adult stem cells or progenitor cells in bone marrow aspirate. One is mesenchymal stem cells and other is hematopoietic stem cells. So mesenchymal stem cells exist at a pericite on the outer surface of the capillary veins and arteries throughout our skeletal connective tissues. And hematopoietic stem cells are adult progenitor responsible for the generating erythrocytes, platelets and leukocytes in the bone marrow. So mechanism of action, BMAC, how it works. BMAC contains concentrated dose of the stem cells and growth factors which stimulate the tissue growth and repair. Stem cells are the cell in their raw form before they specialize to become a different types of the tissue. Mesenchymal stem cells are the type of stem cells that replenish the soft tissue, cartilage and bone. They are less abundant in bone marrow other than other types, so concentrated dose is more likely to help. Some quality and collections, bone marrow aspiration, mostly we prefer the site of small volume aspiration, maximize the total nucleated cell including the progenitor cell, resulting in better clinical outcomes. Common site of collection is iliac crest. Total nucleated count, cell count is considered as a quality of BMAC, and if it is more, then we have good quality of the bone marrow is there. Peripheral blood contains 5 to 10 million WBC per cubic millimeter, but high quality bone marrow aspirate may have 20 to 40 million total nucleated cells per cubic millimeter, which can increase 5 to 10 fold after centrifugation process to prepare BMAC. So just showing some slide how to prepare the BMC. Again, same ACD solution we will take, and specialized kit is also required, and bone marrow biopsy needle is there. Mostly I take bone marrow from posterior superior iliac spine. There are 12, 11 and 30 gauge cannula, 10 and 15 centimeter. Difference is available, but 13 gauge cannula with 10 centimeter length is mostly enough. No need to do anything. And this is a small video showing how I aspirate injecting the. फास्ट फॉरवर्ड कैसे होता है? So I am just tapping my needle in the posterior superior iliac spine and breaching the cortex and going inside the bone marrow, and I am removing my cap and aspirating. This is the confirmation. Fluid red color bone marrow is coming out, and I'm just take a sample, and now I take ACD solutions and I collect the bone marrow, gradually slowly collecting with rotation of the needle and different levels. So after some aspiration I will withdraw my needle, so different level I can aspirate. This is a centrifuge, a simple centrifuge, and first spin is 3200 rpm for 10 minutes, and second spin with 3000 rpm for 5 minutes, and this bone marrow is ready to use. So application of bone marrow is mostly osteoarthritis knee, intra-articular and intraosseous, avascular necrosis of hip, intraosseous we can give in the inside the hip, degenerative disc disease in the spine, disc with annular tear we can insert, in the disc, and we have very good, we can develop fibrosis and strengthening inside the disc. Any muscle, tendon, ligament, partial and interstitial tear, we can inject in that for a tissue healing purpose. The last is mesenchymal stem cells. Definition by stem cells are defined as an undifferentiated cell that have the ability to replicate and differentiate themselves into the various tissue cells. Stem cells play an important role forming the organ at a stage of embryonic development and restoring the organ and renewing tissue functions in fully developed adult as well. So stem cells therapy categorized into the placental and umbilical cord stem cells, hematopoietic stem cells which is situated in bone marrow, adipose tissue derived mesenchymal stem cells, bone marrow derived mesenchymal stem cells. So we are talking about mesenchymal stem cells. Application is osteoarthritis, AVN of the hip, musculoskeletal and neuropathic pain treatment like diabetic neuropathy, spinal cord injury, but not in our scope of pain management. So the preparation of MSC. So there are two types of the preparation is possible. One is the stromal vascular fractions and other is a nanofat. So what is SVF? SVF is a non-adipocyte cellular fraction of adipose tissue obtained by enzymatic or mechanical processing. It contains adipose-derived stem cells, stromal cells, pericytes, endothelial progenitor cells, fibroblast, macrophage, lymphocyte, extracellular matrix fragments. So mechanism of action is SVF promote the tissue regeneration primarily through paracrine signaling, releasing growth factors, cytokine and extracellular vesicles that enhance the angiogenesis, modulate the inflammation and stimulate resident progenitor cell activations. These combined effects support tissue repair, neovascularization, remodeling, particularly in ischemic or poorly vascularized environments. The other preparation is a nanofat. Nanofat is a simple preparation. It's a mechanically emulsified adipose tissue product rich in stromal cell and adipose derived progenitor cell, but largely devoid of mature adipocytes, primarily used for tissue rejuvenation and MSK regenerative applications. Usually in my clinic, I prepare nanofat for the treatment purpose. I am not using SVF. So this is nanofat instruments, finer lipo-infiltration cannula, liposuction cannula is there, nanotransfer sets are there. And this is how I do a liposuctions. Usually I used this finer cannula, 3 mm size cannula, and length is 15 centimeter. It has a multiple holes, and I usually do without local infiltrations. I just give bilateral tap block. So 4 to 5 centimeter area of bilateral abdominal area I can get for aspiration, and I inject normal saline with adrenaline and with hynidase for better fat aspirations. This is the removal of the I just keep my syringe in a standing position, and the water is removed, the normal saline is removed from that, and this is the pure fat. And then is the gradual emulsification process. So emulsification done with 2.4 millimeter transfers, and there are different size of transfer, 2.4, 1.4, 1.2, 1 and 0.8. So this is last 0.8 nano transfer, and every time usually 15 to 30 times we are transferring the fat from each syringe. And the last one is this is the 500 micron size nano transfer. So final emulsifications, so we can got very small granular fat size, and we can inject with at least 22 to 20 gauge needle inside the knee joint and whatever pathology we want to insert. So future of stem cells therapy, currently the stem cells treatment is still in a very early stage of clinical use. The future of stem cells is very bright. With help of accumulating evidence and technologies, we can control many non-curative diseases with help of stem cells like spinal cord injuries. Here I want to show some my case studies. Here you can see this tennis elbow patients with partial tear and post-operative after 1 year of MRI, you can see the gradual good healing. The same patients having this is a partial tear, and after PRP treatment, very good healing of the tissue is there. Tendo-Achilles tendon, and you can see this long 4 centimeter interstitial tear with patients, and I do PRP treatment, and after 1 month of MRI showing almost 80% of tear is healed. ACL partial interstitial tear, I usually do ACL tear under CT scan guidance, and this is my contrast material showing that I injected purely in the ligament substance, not in the knee joint. And lumbar spine in degenerative disc disease, I used to give bone marrow. I did many cases, and you can see this annular tear L3-4 disc and complete healing of the annular tear. And this is the same case, annular tear with contrast material leaking outside, and after 3 months of BMAC, the annular tear is healed and contrast is not coming out. The last two sides. This patient is having a 3-level annular tear, 3, 4, 4, 5, L5S1, and you can see complete healing after 2 months. I did this MRI and complete healing in all 3 discs. So, thank you.